let's talk about the R sound. It's one of the most challenging sounds to fix in speech therapy. So if you're a parent watching this, just know that speech therapists really have a hard time. So if you have a hard time helping your child with the R sound, you're not alone. Even SLPs have a hard time with this. So let's talk about kind of differentiating the types of R errors when it comes to understanding how to actually go about fixing that R error. So for our younger kids, like I would say 6 and younger, most of the time what these kids are doing is what we call a sound substitution. So they're taking this R sound and they are substituting it because R is too challenging to say motorically. So they tend to use an easier sound to produce, like the W sound. So red sounds like wed. That is what we call gliding because they are producing a W, which is a glide. That's just a category name that we give that W sound in place of this R. And so for younger kids who tend to have that obvious sound substitution, the best place to start in therapy is to begin with auditory discrimination, meaning, do they even hear the difference between a sound or a word that has a W versus a word that has an R? So for example, walk, right? If you're gonna walk down the street, do they understand that walk is a different word from rock? And so the first place I like to start in therapy with my younger kids who have these phonological types of errors is just holding up 2 pictures of walk and rock, and I'm gonna say the word to see if they can point to the one that I said, because often kids don't hear the difference. They don't even know that those are 2 distinctly different sounds. So that's a great place to start. And if they do struggle with that picture of walk, like maybe a child walking, or a picture of a rock, and they don't hear the difference, what I will do is I'll take the images away and I'll direct them to look at my mouth. And so I'll say the word walk and I'll overemphasize that W, my lip rounding, and have them look at me and say, now what word did you hear? And then I'll hold up the pictures. Walk. And if they don't get it right then I'm gonna put down rock and I'm just gonna hold up the word walk next to my lips. Walk. Watch, look what my lips are saying. Hear what my lips are saying. Then I'm gonna go to the next word and I'll say and I don't round my lips. I'm showing them I'm curling my tongue back a little bit. Rock. What sound do you hear, or what word do you hear now? And so once they can get really good at distinguishing that sound and understanding what words I'm saying when I say walk versus rock, or any word pair that you might have that only differs by W and R, once they can do that pretty consistently, then we're ready to start working on eliciting the sound or teaching them how to say the sound. And for my younger kids, the best way to do this is keep our cues very simple. I'm not going to cue a 5-year-old in the same way that I might cue an 8-year-old or a 10-year-old who is also struggling on those sounds. We'll talk about those kids in a minute. But what I do is create the distinction. Just like we used with our discrimination, we're gonna use our lips for one sound and our tongue for the other, and usually that's about it. Those are the only cues that I distinguish or differentiate those 2 sounds with for my younger kids. Then we can work on getting closer and closer approximations, and I'll cue them to say, curl your tongue tip back a little bit, rock. Round your lips for this word, walk. And we practice those words in pairs. And when we get to that R word, I found one of the most helpful strategies is to use what we call slowed simultaneous production. And this comes from an intervention for apraxia, childhood apraxia of speech, developed by Dr. Edith Strand. But it's an aspect of cueing that will just help simplify the speech task for the child. So if they're struggling with rock and they're still saying walk, I'm gonna start out by saying, okay, watch my mouth, get your mouth ready like mine is. I'm curling my tongue back, and I'm gonna wait and say that sound. I'm not gonna say the rest of the word until that child attempts to match what I'm doing at the same time. Rock, and we slow down, rock, and say it slowly with that child.
On this side, you say it by yourself with your lip sound, and then we'll say the tongue sound together. You ready?
Right.
What's this word here?
Wing.
Wing. This word is ring. What about that one?
Right.
Right.
Rack.
Rack.
Wide.
Right. Nice job. That sounds like a closer R sound every day.
My encouragement to you also, though, with these younger kids is not just to drill the R sound, because what you'll end up doing is kind of reinforcing that we only want the R sound now, where we actually need to teach that child that there is a time and a place for R and also still a time and a place for W. And so a phonological intervention or approach is the best way to teach that. So perhaps minimal pairs, where you're gonna just stick with those pairs of words to help them produce now W words and R words so that they understand the rules, and we teach them when R is appropriate and when W is appropriate. Now let's talk about those older kids though, because once a child reaches the age of about 6 or 7 or even 8, they're probably having a different type of motor-based error at this time. Maybe what started out as phonological, that obvious W substitution, has now kind of morphed into maybe more of a distortion. So instead of saying walk for rock, it may sound like lock for rock. It's not like a perfect R. It's not a W either, though. You don't really know how to transcribe it or how to even describe that type of sound. It's just maybe more vowelized. And so when a child has that kind of an error, the best thing to do is to get really specific with our cueing. So if we think about how we make the R sound, as speech therapists, we tend to have this dichotomy in our mind of a retroflexed R, where we're teaching tongue tip to curl, or we can teach a bunched R, where we're teaching the back of the tongue to just bunch back in the back of the throat. Now, in my opinion, I think those are too simplistic, because what we know from Dr. Jonathan Preston and colleagues from his 2020 article is that we actually need 5 movements to make the R sound. The first thing we need to do is we need the tongue tip, or the front half of the tongue, elevated to some degree. Now, if we're doing that, that kind of sounds to me like a retroflexed or a tongue tip curled R, doesn't it? But everybody produces that or elevates their tongue tip to some degree if you're gonna make a crisp, clear R, even if you're gonna teach a bunched R. The second thing that always has to happen, according to that 2020 article, is we need the tongue root to be retracted to the pharyngeal cavity, so we're pulling it kind of backward. And that kind of sounds like a bunched R, right? But even if we're teaching a retroflexed R, we still have to get that pharyngeal restriction by pulling that tongue root back. So both of those movements have to happen no matter what we're teaching or how we're teaching it. But here's the thing, if you're only going with one or the other of those movements, I think you're probably missing what is the key to most of my older kids who are distorting the R sound, and that is lowering of the tongue body by elevating the sides of the tongue up. So what's happening is we're elevating the front, we're pulling the back, we're lowering the tongue body, and we're elevating the sides. That is so challenging for so many kids. So in order to teach that particular movement, I love metaphors and use a metaphor cue that works best for you, but I love this metaphor of make a bowl with your tongue. Because if you can do that, lower the midline, right? Lower the tongue body, you're elevating the side, the front, and the other side, you're gonna take that bowl and scoop it up and back so that it's touching your molars, because that is the only point of contact for the R sound. The sides of your tongue need to be anchored up against the molars. We call that lateral bracing. And if you're only working on tongue tip elevation or tongue tip curling, that retroflexed R, or you're only working on bunched R where we're just pulling the back of the tongue back, you're missing the lateral bracing, which is the key component, in my opinion, for most of my kids who older kids who struggle with R, that's what they're missing. So if we can get a tongue bowl, pull it back and up to touch the molars, we're gonna get a clean, crisp R. And here's the other thing. Here's the 5th movement that we always need to make an accurate R sound. We actually need slight lip rounding, which I know can be interesting, because if we have our younger kids who are producing a W sound, we want to eliminate the lip rounding, right? What we do with our younger kids, I'm talking about older kids who are distorting R. It is okay to teach lip rounding for these kids. In fact, I encourage it, because we actually do need lip rounding. Even with words where we have like an E sound, right? We want retracted lips for read. Even if you're gonna say a word like read, get ready to say it and freeze before you say that word. My lips are rounded. They're slightly rounded. Read, even next to that retracted lip vowel. So 5 movements we have to teach. That can be really challenging. But if you use some strategies like metaphor cues, tactile cues, and other kids will need all kinds of helpful multi-sensory cueing in order to help them actually achieve that. And if you need help, I have a 2-hour course that will teach you strategies with more therapy videos to show you those strategies in action. That is linked below, so feel free to check that out.